In this program, Mary Borg and Gary Morgan with SafeLink will discuss the challenges faced by dental practices and laboratories when dealing with OSHA compliance. They will discuss the following topics: hazard communication standard, emergency planning, bloodborne pathogen standard, operatory, bloodborne pathogen standard, sterilization, lab work, and ergonomics. We join them now in the office to discuss these topics.
Gary, we've worked in dental practices and dental laboratories all over the country and experienced with them the challenges that they face with OSHA compliance, Occupational Safety and Health Administration, and the challenges that that presents for them. And we feel like there's a lot of knowledge out there, that they understand what the regulations are, but how do they apply them practically in their practice? So this would be a good session for us to review how they can shape it up. How can they shape up their program?
Well, absolutely. I think as we've both encountered when we walk into a dental practice, we realize that their major focus is the patient and what they're going to be doing with the patient. And OSHA's concern is basically the employee's health and safety in that environment also. And so sometimes we tend to put that in the background, so we need to focus more on that. And in doing so, develop a program that follows the OSHA recommendations so that indeed we don't have any risks in the workplace. We identify those risks where they exist, and then we have a situation where we can control as best we can in that situation those risks. But we've got to develop a program, and that's what really we see in most dental practices, is that they don't have a comprehensive program to handle all of these different situations.
Mm-hmm. So aside from it being the law, and we all hate to hear that, but it is the law that we have to do this, it's simply the right thing to do. It's the right thing to do for the staff, for the doctor, for ultimately it helps the patient, as we know. But it also, don't you think, makes the dental practice a better place?
Well, I would certainly think so. I mean, I want to work in an environment, especially a healthcare environment, where I know that we've considered all of those risks and we've taken some action to reduce or minimize those risks to the employees. And therefore that we won't have an accident, we won't have an injury, we won't have an illness that is caused by something that we've done, in the practice itself.
Which of course relates to workers' compensation.
Absolutely.
And when we're thinking about a business, workers' comp premiums can get rather costly. So having no injuries or limiting the number of injuries can keep our work comp premiums down. And not to mention that OSHA inspector, who can come in, of course, at any time, depending on the number of workers. If you have 11 or more employees, then they can come in on a random inspection. So the fines can be rather substantial if they do find some defects or problems in their inspection.
It absolutely can be. And you have to realize that different states also have different regulations. It's not just OSHA. You have to look at all those regulations and how they work together to provide that environment where we have a healthy and safe workplace for everybody. But you've got to do your homework. You've got to realize that it's not something that you can just sit back and have it just happen. You've got to put in the time and effort and get the training, understand what the requirements are, and invest in the people, giving them the support they need as the employer so that all of these things can be done in the workplace.
Well, when we're talking about the support and the people in the workplace, the safety coordinator is an important part. The safety team is an important part. So we've worked with practices to help them select the right person.